Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Does sperm morphology affect fertility? Is it very important? Because we talk about count, motility and morphology when we are trying to assess sperm in semen analysis. Yes, count is very important because without the proper count, the right number of sperms will not reach the egg. Yes, motility is very important because without motility, sperms that are ejaculated in the cervix area will not be able to swim up till the egg. So it's very critical that the proper count and motility be there. Then what is the relevance of morphology? Morphology refers to the shape as to how the sperm should look and how it should be shaped and how it should measure and be able to move. In these proper guidelines, only the sperm will have proper motility. So to understand the importance of morphology, let's try to understand how a man is actually assessed for infertility. The most important and the first test for analysis of an infertile man is semen analysis. Within semen analysis, we try to look for count, motility and morphology, as I said. How are they assessed? Very simply, sperms are assessed under the microscope. Of course, they are stained properly to understand the parts of sperms so that we can report properly. Every part of the sperm has a relevance, has a functional capacity. Therefore, it's very important to look at all these parts very crucially. But what is the criteria on which we base the sperm morphology? The assessment is based on World Health Organization classification, and it has given us some guidelines to assess sperm morphology. Kruger's strict criteria maintains that in 100 sperms that we count, a minimum of 4 should have proper morphology. Only then we can give it as a normal report. So what is a normally shaped sperm? A normally shaped sperm is a smooth oval shaped cell which has a head of about 5 to 6 micrometers long and 2.5 to 3.5 micrometers wide. It also has an acrosome or a cap. The head has a cap. It's very critical because that is what interacts with the egg. About 40 to 70% of the head of the sperm is occupied by the nucleus. That's a very important part as well. In addition to the head, there is the midpiece and the tail. So like I said, the head has the DNA, the head has the nucleus where the DNA content is. The midpiece has the mitochondria, that's the battery of the cell. The tail is very critical for movement. So these 3 parts are very important when we are trying to assess the sperms. The sperms that are assessed also should be under the right kind of maturity. When we evaluate, we also need to see if they are immature or mature. The most important question once we report that the sperms are abnormal that is asked is, can an abnormal sperm fertilize an egg? Yes, the answer is definitely yes. The abnormal sperms can also fertilize an egg, but the capacity of the embryo that is formed from such a fertilization depends on what kind of morphological defect was there. There are not many studies that give the importance of this, but some studies are revealing definitely that morphology is a very important aspect of fertilization and therefore clinical pregnancy and live birth rate. The kind of abnormality affect infertility, another very important question. Yes, the kind of abnormality, not just that, the number of abnormalities also affects infertility. If the head has vacuoles or holes, if the midpiece is bent, if the tail is duplicated, all these issues will cause more problems in the embryo, may also result in genetic abnormalities and therefore result in either a miscarriage or implantation failure, that is the no pregnancy, so on and so forth. So it's very important that we evaluate what kind of abnormality is present in the sperm. Is there anything you can do to improve the sperm count? Definitely a lifestyle modification, reducing smoking or totally giving it up, reducing alcohol, reducing hot baths. All these affect the quality of sperms and definitely they can be improved. But for any improvement, remember that a minimum of 2 to 3 months have to be patiently given so that you see some improvement in your morphology defect that has been reported. If you have been diagnosed as having abnormal sperms, or you have been having miscarriages with your partner, or you have been diagnosed as having high DNA fragmentation, you want to understand more about what the issue is and what your treatment options are, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.